directorate in charge of research.
Thank you for that. Now, Dr. Helena, we had spoken about the breast cancer comprehensive care that is found here, and I'd like us to go back to that issue as regards how timely it is in terms of when you get the results and what exactly happens in that particular center.
So we have the Comprehensive Breast Care Center, which is a novel idea in the country, was launched, it's just about a year old now. And we're able to cater to both men and women who have got breast cancer or breast care concerns. And so it's a rapid results initiative clinic, and we're able to make a diagnosis within 60 days and initiate treatment as well within that time. I think we're doing better than that target that we were given of 60 days, and we're diagnosing and starting treatment earlier than the 60 days. And we're able to do everything. So we're able to screen our patients. We have ultrasound, mammogram, MRI. We have got pathology services available where we can be able to get the biopsies done. We also have got nutritional support. We've got counseling support. We have an active support group where we are able to cater for those that are survivors and those that are going through the journey with breast cancer to be able to, get some strength through others that have made it. And then we also have palliative care. And then with the other treatment modalities, we're able to offer chemotherapy, immunotherapy, as well as radiotherapy to these patients. We also have 2 dedicated breast surgeons and are able to offer specialized breast surgery for these patients.
Right, and on the other leading cancers as well, which would be the cervical as well as the prostate, do we have any advanced technology that patients can find here?
Yes, just touching on cervical cancer, we have a screening program. It's unfair to have a woman walk in and only screen for one cancer. So we're able to screen not just for the breast cancer, but also cervical cancer. We know that these are the 2 leading malignancies in women and also the highest cause of mortality in terms of cancer deaths in the country. Cervical cancer screening, and for those that have early lesions, we're able to treat them in the pre-invasive stage. Those that are diagnosed with cervical cancer, we have a gynae oncologist available in the team, and we also have treatment options available. For prostate cancer, we have diagnostic facilities where we have the PSMA PET CTs that is specific for prostate cancer,